Welcome to the Peakday podcast, where we discuss fertility and natural family planning with our friends. Our guest today is Nicole Snyder. Nicole is a board-certified family nurse practitioner. She practiced conventional medicine for years before entering the world of integrative and functional medicine. She works with fertility patients and patients with hormone dysregulation and has been certified through FEM at the provider level and through Creighton at the instructor level. Nicole has a passion for women to know that their bodies are good and that fertility is a sign of health. Nicole currently lives with her husband and 6 children in Columbus, Ohio, where they experience a rich and abundant life as a homeschooling family. Welcome, Nicole, to the Peakday podcast.
Thank you. Thanks for having me on. This is really fun.
It is my pleasure. And thank you for taking time out of your probably very busy day. Your kids are all where? Are they scattered
about? Yes. My husband's taking care of them behind the doors. So hopefully all is well. Yes, we have 6 kids from 4 months old to 13. So we're in the thick of it with many stages of life right now. Yeah.
Wow, 4 months. Congratulations.
Yes, thank you. Yeah.
Yeah, and then a teenager.
Yes. Yes.
You've got the whole gamut.
I got the whole, all the ages. Yeah, it's great.
So when did you become interested in nursing and in the medical field?
Yeah, I actually got my initial degree in speech and language pathology. And maybe about 6 months before graduation, I decided I didn't want to do that anymore. And I was like, well, I've really invested. I've gone almost the whole way. So I decided to just finish that degree out and then went back for nursing. And then after I became a nurse, went to get my advanced degree in nursing. And so that's kind of the progression that took. Yeah, it was... I was discerning my vocation at the time and was with the Missionaries of Charity. And I was doing a lot of nursing type tasks there and just really fell in love with it. When I realized that the Lord was not calling me to be a religious sister, just kind of like reevaluating my life, that was when I said, well, I think I would like to go back for nursing. So that's kind of how that all started.
And then marriage and kids, when did that all kind of work into the plan?
Yes. When I got back, I really fell hard for my husband. He was a focus missionary at the campus that I was getting my degree at the time, and I thought I was being very cool as a cucumber, but he told me later that he could tell that I had a huge crush on him. So that was embarrassing. But we started dating and it really took off from there. So it was, God's timing. It was wonderful.
That's wonderful. So you practiced, as a nurse practitioner for several years. And then what was the turning point for you to pursue integrative and functional medicine?
Yeah, so I was working at a conventional clinic where we just kind of saw all different kinds of things, acute illness, chronic illness. And when I applied for that role, I was upfront with the management that I was going to not provide contraception due to my conscience. And they were great. I just had to sign some papers and it was all good. Well, years went by and the culture around us changed and the management changed and all things kind of like collided together to our conscience protection going to be taken away at this company. So there were several of us who were protected with this conscience protection clause. And it turned into a big fight. The providers ended up winning, but at that point, my desire to work at that clinic was already kind of soured. So I was looking for a new job. There was a wonderful Catholic practice in our town owned by a wonderful doctor named Dr. Alan Lewis. I decided to start shadowing with him because I figured, well, if it's a Catholic practice, I'm going to not be asked to do anything against my conscience. So that seems like a safe place to work, and had no idea that it was functional medicine. I just thought it was a Catholic practice. So I started shadowing, and it was a big surprise. The first day, we were seeing a lot of new patients, and immediately in my head, I thought, these are the kind of patients that we're not going to be able to help. We might be able to like stop the progression of their illness or maybe help them with their symptoms, but we're not going to be able to actually help them, you know? Mm-hmm. That was a very conventional medicine kind of teaching with certain chronic illnesses. The second day, we started seeing a lot of follow-up patients, just kind of how the schedule worked out. And these patients were coming back with very similar stories to the first day's patients, but they were getting better, like all the way better. And I was just like shocked. I in my mind, I was thinking this has to be fake. I can't believe this. Interestingly, there was an OBGYN who I really respected as, personally and professionally. He was a wonderful Catholic man, big supporter of the pro-life movement in our city. And he just happened to be at the clinic that day. And Dr. Lewis left to get something out of his office. And I just pounced on him and said, Dr. Parker, you need to tell me, is this stuff for real? Is this real right now? And he just like smirked at me and he said, oh yeah, it's for real. Wow. And I said, well, then I have to learn how to do this. So I started working there, and that was kind of how I got into functional medicine, kind of by accident, but really it was the Holy Spirit.
Oh yeah. There are no accidents. Right?
Yeah.
Oh my God.
Yeah.
So what exactly is functional medicine, and then as a follow-up, integrated living? What does that look like?
Okay. So functional medicine, I think of it more of like a worldview shift. So instead of thinking this is the disease state that this person is experiencing and I'm going to intervene in this disease state, it's more of this person is experiencing these symptoms, and if we can figure out what the root cause of these symptoms are, like what's kind of happening that's making this person's body out of balance, if we can intervene at that root level, then think of like a tree. If their roots are diseased, the whole tree is going to suffer. So instead of working at the leaves, we work at the roots and try to get somebody actually to a state of health instead of just managing their symptoms. So it's very heavy in diagnostic, really doing a lot of testing to really get at the root cause of what's going on. A lot of lifestyle management. Often we're needing changes in someone's lifestyle in addition to herbals or nutrients, sometimes medication, to get the roots healthy. And then the hope is we can peel back some of those layers of support once the roots are healthy, and then they can just thrive in the soil where they're at. So that's kind of how I think of functional medicine and explain it to patients.
Mm-hmm. And then an extension of that functional medicine and the healing that your patients go through, that kind of brings in that integrated living.
Yeah, and I think it really complements well with a Christian worldview. If God made our bodies and he made our world around us, he made our bodies to live in this world, so many wonderful things that God has just put into nature, and we're supposed to discover it and use it to help preserve and treat different health things. So I really love it because I feel like it's, first of all, it's just exciting and just so fun, but it's also really honoring to God and honoring the way that he made us and the way that he made our world. So that's kind of, yeah.
Right. So were there, did you experience any challenges to overcome when you made the change from traditional medicine to functional medicine?
Yes, I would say the first one was a huge learning curve. So when I accepted the job, Dr. Lewis just handed me like a stack of textbooks and said, go read these books. And we'll get started after you're done reading all these. And I was like, wow. And that was just the beginning. There was just so much to learn. I felt like I was starting over from scratch. And actually worse than starting over from scratch, because it wasn't just I was learning new things. I had to unlearn beliefs that I already had, So I would say I had a notebook with me always, and I would write down all these things in a day that I realized I didn't know and had to learn. And then at night, I had to, do a couple of hours of homework every night. And this is after I had 3 kids at the time, and one was a new baby. And so it was a lot of work, but it was so exciting to learn all these things and see people start to get better that I thought I would never have been able to get these people better beforehand. So it was really exciting. The second challenge was just, there was a lot of growth and humility that had to happen, which is always good, but never fun to go through that. But just realizing, as I'm learning things, patients from the past or things I've said to patients were coming to my mind, and realizing that I was wrong for a lot of things. And I could have helped people better if I had known the things that I'm learning now. But yeah, just getting over that and having to just kind of face my ignorance in the past and say, well, now I'm going to learn and do better moving on. So yeah, those were kind of the learning pain, the growing pains.
Sure. What a challenge. I don't want to bash traditional medicine because it does so much good.
Absolutely.
But it just sounds like there's, a big disconnect, or a big, like, as you said, you had to make that shift in your thinking. What would you like to see happen within the medical field to kind of, bridge that gap?
Yeah, I think it's going to be difficult because the way things are set up. I'll give this example. I had another nurse practitioner who's a friend of a friend, and we were at a party together, and she was just asking what I did, and I was getting excited, telling her about what I did, and I can get pretty passionate. So she was really intrigued, called me a few days later and said, I would really love to learn more about functional medicine and how I can incorporate it in with my patients now. I said, I'd be very happy to teach you. But one thing that's a concern is you only have, at her current job, she only had 15 or 20 minutes with each patient. And to really get at the roots of the plant, it just takes longer than that. It's just impossible to see beyond the leaves when you only have 15 minutes with someone. Right. So I would say that's a big barrier, is the time constraints that, and it's not the providers. I don't know. It's no one's fault. It's just the way things are. There's a lot of pressure to keep visits short so that they can see more patients. Right. So that's a big barrier. But I think patients really are hungry to actually be well and not just managed, so people are hungry for this type of approach, and they're seeking it out. So functional medicine is just growing by leaps and bounds. So
how do you help incorporate the whole family when just one member becomes invested in integrated living?
I usually see one person get very, and it's usually a parent or a spouse, get really excited and gung-ho. And then they can kind of rub the rest of their family members the wrong way because they're trying to move so fast and drag everyone along with them. So just kind of reminding them that this is all about baby steps and progress over perfection. And everybody is on their own journey and has to move at their own speed. So, thinking about my own family, I have a 3-year-old, and if I want to make lifestyle changes in her life, I just do it. I'm her mom, and she's 3, and she has to do it. With my 13-year-old, that would be a different kind of way I would approach that, because she has very strong opinions about her own life, and I don't want to, dominate that. So And then with my husband, it'd be a whole different level of conversation because he's an adult and can make his own choices. So I would just kind of encourage people that it's great that you're getting excited. It's also okay that other people are not, and baby steps moving forward.
Mm-hmm.
Yeah.
Mm-hmm. So for your fertility and hormone patients, what kind of trends are you seeing in symptoms, or are there trends?
Yeah, so I think it's pretty well established that the rates of infertility are increasing, and that's worrisome. I think there's a lot of factors that play into that, but shy of true like infertility, I'm also seeing a lot more hormone dysregulation symptoms. Things are happening sooner, younger, and that's a consequence of lifestyle, environment, toxin exposure, all sorts of things. And so it's happening younger and younger. And so we see hormone dysregulation in a 12-year-old, and that's not how it used to be, So it's great that we can intervene sooner so that we can get them feeling better, but then also preserving their fertility for decades.
Can you explain what exactly is hormone dysregulation?
Great. So yes, so I would say it is when things are out of balance. So maybe estrogen's too high and progesterone's too low, or vice versa, or testosterone is too high or too low, or the thyroid is making everything act funny, and the hormones all talk to each other and play into each other. And so when something is going wrong with one hormone, things go wrong kind of downstream. And so that's what I mean about hormone dysregulation. There could be symptoms of, PMS, mood symptoms, breast tenderness, extreme cramps. Instead of one day of, oh, I don't feel that great, to 10 days before your period, really suffering. That something's not right, and we can figure out what is not right and intervene in that to get someone's hormones to be in balance.
Mm-hmm. And, you mentioned how some of the symptoms that you're seeing. Are you also seeing women and young girls charting? And can you see, hormone dysregulation within, the charting patterns?
That's great. That's a great question. I would say with charting, it is really helpful to be able to see things. I would say when I started charting, when I was engaged, just kind of going through an NFP course to prepare for marriage, there were signs of trouble in my chart, and I had no idea. And I was already in the midst of getting my advanced degree in nursing, and my NFP teacher was like, "Uh-oh, I think we're going to have to figure this out, Nicole." And I was just completely clueless. It was really cool because God did this on purpose so that we could see clues before we're even in the situation where we're experiencing heartache with infertility. So yes, definitely seeing signs in people's charts with or without symptoms attached is very helpful.
Right, because those chart signs show up sometimes before the symptoms show
Certainly,
up.
yes.
Right.
Yep.
Interesting. Right. So having trained in fertility awareness-based methods yourself, I imagine that comes in handy when you're having those conversations.
Oh, yes. Yeah, yes, definitely. I would say I was shocked and really just tickled pink when I was going through my NFP class to learn to chart myself. It was just like a whole new world, and I was mad too. I was happy and mad. I was like, how come no one taught me this when I was 13? I had to become 7 years into college, and I still never learned any of these things. So I was really excited to bring that knowledge to others so that teenagers that I work with can see, oh, this is normal. The discharge you see in your underpants mid-cycle, that means your body's doing what it should be doing. That's great. Yay. And like, what does that mean? And these are things that, might be going wrong, and you should talk to your mom about that and we can sort it out. And yeah, so I would say it's just very exciting and wonderful.
I bet.
Mm-hmm.
So how do you get your clients? How do they hear about you?
Yeah, I would say a lot of word of mouth, and a lot of internet searching. So I'd say those are the two primary ways. And then the office I used to work at, I stopped working there. The wonderful practice that taught me functional medicine, with baby number 6 on the way, I decided it was time to stay home and work from home doing telehealth only. And they were wonderful. So they refer all their hormone patients over to me too. So that's great.
Oh, wonderful. So you are on your own. You're not with the practice anymore.
I work for a company called My Catholic Doctor, and it is kind of a platform where providers can kind of like plug into that platform and have their own practice. So similar to Airbnb, where everybody has kind of their own little puzzle piece that's plugged into the whole. Yeah.
What future do you see for integrated and functional medicine?
I think it's just going to explode. People are sick and tired of being sick and tired, and they really want to get at the root, to actually get to a state of health instead of just suppressing symptoms. People are hungry to like really be well and feel well. And especially women, there's a lot on a woman's plate. There's a lot of people in her life that she has to serve, and she wants to feel good enough to do all the things that she needs to do. And so I think, it's just going to really explode from here.
Right. So you say that you want to encourage women to know that their bodies are good and that fertility is a sign of health. How do you convey that to women who come to you as a patient?
I really like showing them slides of, it's almost like a 7th grade biology class, or what should be a 7th grade biology class, showing them kind of like what the hormones look like in a typical healthy cycle, what the corpus luteum looks like after ovulation, what's going on in this part of the month in the uterus, in the ovaries, in the rest of the body, how that works with memory. For example, there's been studies that show in the beginning part of the cycle, so the time from menstruation to before you ovulate, women do better on standardized testing than if it's the second half of the cycle. It's just amazing. And that's because estrogen can help with memory. The lack of estrogen, when progesterone is high, it's not as good. And so it's just like how I just tried to convey how wonderfully women are made, and it's a complex system. Nobody's going to deny that. There's a lot of moving pieces. The more complex the system, the easier things have of breaking. We just bought a new car with baby number 6. We outgrew our old vehicle and had to get a new, bigger vehicle. Sure. And this new vehicle has all the bells and whistles and just crazy. And the first thing I thought when we got this car was, this is going to be a car that has a lot more maintenance that's required. And that's a woman's body. It's amazing. It's complex. It's wonderful. It needs some special TLC to maintain.
Right. Oh, that's beautiful. Just helping women know about their bodies is, as you said, why don't we know this when we're 13 years old?
Yes.
Life would make so much more sense.
Yes.
Our brains are so different. But yeah, it would alleviate a lot of angst and anxiety, I think, for young girls especially. Oh,
yes.
Yeah. If only, right?
Nicole? Yes. One step at a time, baby steps.
That's right.
We're going to get there. Yeah.
Oh, yes. Let's hope we do. So, Nicole, you're practicing functional medicine, integrated medicine, which is, kind of a step beyond, traditional medicine, let's say. But then you're also a Christian as well. How important is that for somebody to incorporate their faith and their beliefs into the practice of getting healthier?
I think it's really a relief when somebody who is Catholic or Christian is coming to me and they realize that I'm of their same worldview. They can kind of like let their guard down. I know when I go see my OBGYN, who's wonderful, I really like her, but she does not share the same worldview as me. And there's always a little like, I've got to be on, I just have to have my shield up, of
Yeah.
what is she going to suggest? Is it going to be moral? When somebody doesn't have to have their shield up, they can just receive. It's really like not only medicine, it's ministry, and I can really like minister to someone's heart in this very vulnerable, tender spot of having
Yes.
hormone dysregulation or infertility, and they can just let their guard down and be served and be received for where they are.
What a great point. Yeah, you are. You're on the defensive almost when you're seeing somebody who does not have that same kind of worldview. So, excellent point. And thank you for being that person for others, Nicole. That's wonderful.
Yeah.
Again, thank you, Nicole, for spending your time with us on the Peakday
Okay,
podcast.
well, great. Thank you so much.
All
I
right.
had so much fun. It was wonderful.